Hey everybody, back at it again today. You can see that the pavement's pretty wet. It's been a few days since I've been able to ride because of the rain. It's been terrible weather over here off and on in Metairie, Louisiana, where I'm on contract right now. So I'm not going to go as far out as I like to go because if it starts raining, I really don't want to get wet. But I wanted to come out here and ride a little bit because I'm starting to feel a little stir crazy and I needed to get out. Today, I want to talk about more of the travel nursing angle of this because last video when I rode from Abita Springs to Covington, it was more about the e-biking. But the travel nursing is a big part of this because that's what allows me to get to go to so many places. Although I guess I can pack up and go anywhere at any time, but that gets me in different areas where I can really explore and go to different historical sites and that kind of thing. So I wanted to talk more about the nursing part of it. Let me push pause here and while we get across the street. Okay, we made it across Esplanade, which is a pretty big intersection here. So anyway, the travel nursing aspect is pretty important, and there's a whole lot of people who are really interested in travel nursing but have not ever been able to do it. And just last week I had two people that I randomly ran into. One was a caregiver from a patient, and another one, believe it or not, was a bartender who said the same thing to me, that they wanted to be a travel nurse but they're not even a nurse yet, but that's what they would like to do. So obviously the first thing you have to do is to become a nurse, and it seems like this is what I told them. It's very daunting, especially when you're young. Both of these people were in their 30s, and one of them had some college and the other one had no college. But the thing you realize when you get to be a little older in life, and you have a little experience, is that the time is going to pass anyway. So one day you're going to be 40, you're going to be 50, but you're not going to be where you wanted to be, and you're not going to do what you're not going to have accomplished what you want to accomplish because you were afraid and you found the task really daunting. Oh, look at this cute dog up here. We're going to have to go around. We'll go real slow. Hi, beautiful dog. Anyway, so, I told both of them, it's like, it's hard doing what you're doing now. It's hard being a caregiver for a patient. You're helping them do all kinds of, showering and changing, their beds and cooking, and you're doing all these really hard things. It's hard work. But being a nurse is hard work. Going to nursing school is hard work. So it's all hard work. Everything is hard. I mean, it's not like you're saving yourself any effort if you don't become a nurse and follow your dreams. If you want to be a nurse, you need to do it. I mean, whatever it takes. I have a friend who, and she'll recognize herself whenever I tell this story. We went to Daytona one year, and she was working really hard, night shift in a factory, and at the time she was making nothing, maybe $10 an hour or something like that. And she didn't have money to spend, and back then nurses used to, whoop, there we go. We're going to see a lot of puddles today. I should have worn other shoes, right? Me and my fascination with shoes. Anyway, and she just didn't have the money to spend down there. It was very expensive. And so we were laying there chatting, in our little hotel room. And she says, well, it's so hard to be a nurse. It's hard, the studying and all. And I said, so what you're saying is that I'm smarter than you. And she, there was this long pause, and she said, "Good point." And so she did. She went back to where she lived in Michigan. And guess what? She enrolled in nursing school. She got her prerequisites. She never thought of herself much as a scholar of any type, but she had a goal, and she did it, and she made it work. And I'm riding in the people lane because there's no people out here, and it seems to be maybe a little less puddles on the people lane, the walking lane. Anyway, so it took her, it took her the same amount of time as it would take anybody. And I remember her calling me. She would call me on the phone, crying, and sit at the table at night crying because it was hard. But she was determined, because I think that probably stuck in her mind that I was no smarter than her. And the truth is I'm not. There's a lot of average, intelligent people that are nurses, and it's just about hard work and applying yourself. So you can do it. You're just going to have to put the work into it and the effort. But that's going to be anything. Even if you don't become a nurse, if you don't go to nursing school, if you don't finish college, if you don't do any of those things, you're going to be putting the effort into something. Even if it's working at, Starbucks or whatever, you're going to work hard, and you're not going to get paid very much if you're working at, some places. Like, that was her problem. So you might as well put the effort and put your concentration into something you really want to do, and just apply yourself and do it, because the time is going to pass anyway. So that's my little spiel about becoming a nurse. It is a lot of work. You will be crying in nursing school. I was crying in nursing school, and I was in my 30s. And that's another thing I was going to say. You don't have to be, in your 20s to go to nursing school. I was in my 30s. I've known lots of nurses who went to nursing school in their 40s and beyond. Oh, look how the waves are going here today. See? It's really wavy simply because we've had such bad weather, and it is windy here today. So, look at those waves. It's almost like being at the beach. Go at it again. Hopefully we won't get wet. We'll get a good ride in, and we won't get wet. But yeah, I don't think it's too late. The latest I've ever heard of somebody going to nursing school was in their 50s. I've known of some. And I've trained some. When I've worked in the hospital, I love training new nurses. I really do. It's so much fun having new nurses come, and so you get an opportunity to, show them the good parts of nursing and try to get them to focus on the good and not the bad. But the nurses that, are older are very focused on what they want to do, because this has kind of been a lifelong dream for them. And so if it's a lifelong dream for you, this has been something you've really wanted to do your whole life, it's not too late. Just do it. And if you're thinking, well, nursing is hard work, and I've got bad knees now, bad back. Okay, well, there's a lot of younger people who have bad knees and a bad back, really. But the other part of it is there's lots of different types of nursing. Okay, you don't have to be a hospital nurse where you're standing on your feet and running up and down the halls 12 hours a day. I've done it. I did it recently, and it is hard work. But nursing comes in all shapes and sizes. You can be an administrative nurse. You can sit in an office all day and do management. You can do hospital administration. I know somebody that does hospital administration. They're not a nurse, but nurses do that all the time. You can do case management. You can do, clinic nursing, where, you work, 5 days a week. I do home health nursing. You can do hospice nursing. You can do telehealth nursing. That's a big one nowadays, telehealth. All the insurance companies, prior authorizations. That's not running up and down the halls, and you can get those jobs. Now you're saying, well, you have to do your clinicals and all that in a hospital. Well, yes, you do. but clinicals are not generally 12-hour shifts. I've never worked a 12-hour shift. Maybe nowadays. So I have had some nursing students stay with me, like follow me for their semester and work my schedule, 12-hour shifts. So some nursing schools may be doing that, but I didn't overwork them. I was helping them. I was doing everything. Matter of fact, that was what was so fun, is that, when they came to the unit, they didn't know anything. They were scared to go in the room and, even really to interact with patients or do anything, because they, in nursing school, everything's under a microscope. I mean, even changing a bed linen, it's almost like they take a quarter and bounce it on the sheet, But in real life, that's not the way it is. And you have to be comfortable interacting with patients. And that's what the first thing I tell them is like, listen, you're going to answer these call lights. I mean, I'm not being lazy, but you have to get used to the patients. You have to get used to interacting with them. And anything you don't know, you just come ask me. Matter of fact, I'm sitting right here and I'm watching, and, we'll do it together. But you go in there and you talk to the patient. So, you learn by doing, really. I mean, you can read a textbook all you want. I can read a textbook, but I don't learn that way. I learn whenever somebody hands me the, blood pressure cuff and says, here, take the blood pressure, and, oh, do it this way, do it that way. And after I do it once or twice, I got it. It's a piece of cake. So anyway, yeah, you guys don't have to think to yourself that it's too late to be a nurse. If you want to be a travel nurse, why can't you? I mean, why do we have this arbitrary idea that you retire at 65 and that, now you're going to be, done doing anything useful other than, planting a garden, which I think is useful. Ooh, big, big, deep puddle. Well, good news, my tires are getting clean from the mud puddle last weekend. But not everybody is needing to retire at 60 or 65. If this is something you've wanted to do and you're 40, you have plenty of time. By the time it's time to, retire, and, your feet are hurting and you don't want to work and whatever, you'll have been a nurse for 15 years. So I say go for it and live your dreams, because it's not too late. The time is going to pass anyway. You are going to be busy doing something. It's not going to be easy, whatever it is you're doing otherwise. So what's your excuse? I mean, what's the question here? So that's my spiel about nursing, and we can talk about nursing more, another time. The good things, the bad things, the great things, the horrible things about nursing, because there's a lot to say about that. But that's not where I wanted to go with this particular video. I wanted to talk about becoming a travel nurse. So after you become a nurse, you have to work in an area for a year that you want to travel in. So if you want to travel in, say, ER, you have to work in ER for a year before you take travel assignments. I would highly suggest you work more than a year. If you're a new nurse and you're just getting out of nursing school, you need to have 2 years of good nursing experience, because when you go out as a traveler, they're paying you to show up and go to work. They're not paying you, they're not wanting to spend a lot of time teaching you different systems and, backing you up. I mean, honestly, when I go out to do a home health travel assignment, I know multiple different charting systems. So wherever I go, I can step in here, give me the computer, I can do it. Ooh, I'm getting all wet with these puddles. And I know how to do all the skills. My skills are great. Somebody told me this week we had a lab we needed to draw, and the manager said, well, she's a hard stick or whatever. I'm like, so? I'm not daunted. So, of course, she was a hard stick. And of course, as most of the time happens, I had no problem getting the lab. I only had to sticker one time. But that's because I've been a nurse a very long time and I have excellent skills. So if I walk into any situation, I'm comfortable with it. I'm comfortable with it, unless it's something I haven't, done before, and then I'm still comfortable with it because I'll find out, after all this time, I know who to call and I know what to do. So you have to learn that. You have to be at that level of comfort before you start traveling. You don't need to be, there's like, you teach in nursing school, there's different levels. There's the novice, the beginner, the novice, the intermediate, the expert, right? So me, if I would consider myself expert, of course, in home health and some other areas, expert. So it makes it easier to do your job. But I wouldn't probably travel. I definitely wouldn't travel as a beginner. They won't hire you. And intermediate, you kind of want to be a little better than that, or have a narrow focus. Like, say, for instance, there is travel in every area of nursing, like home health. Who would imagine that they have travel home health jobs? They do. They have thousands of them. But something like wound care, that's kind of a narrower focus. So in a shorter amount of time, you can be more intermediate. You can, because you're going to learn all the skills and all that at your first job. So probably a year or two, you'll have seen a lot of stuff, and they do have wound care traveling positions, and they do pay pretty darn well. Okay. I would say med surg might be one of those areas you can do in a couple years too. Telemetry kind of goes along with that. I probably would not travel with, ER or ICU or some of these trauma until you're really good at what you're doing, because you're stepping into areas where you have a high likelihood of encountering things you've never seen or done before. And you're a traveler, so it's not like you do make friends. I mean, I do make friends with my coworkers and all that, but it's a little different. It's a little different, especially in the hospitals. I hear that, sometimes the nurses there, some of them are really good, but some of them resent the traveler because they're stepping in there and they're getting paid for the same amount of hours. They're getting paid a lot more money. They don't understand how that works, which I'll explain it to you in a minute. So anyway, those are some areas that you might consider. Labor and delivery. I mean, I see these all the time on Vivian. You can go on Vivian, it's an app, and see what you can explore and see what areas, if you want to be a travel nurse, you want to travel, go on there and see what areas are paying more, and how many jobs there would be in that area. You would be surprised, because home health is one of these niche fields, and I could do a whole video on home health nursing. Matter of fact, I might, because people, are also asking me about that. Nurses ask me all the time about it. And the thing about home health is that, first of all, you can't be a brand new nurse to do home health, because there's nobody there to help you. I mean, if you can't, say, for instance, get that lab, patient's not going to get their lab. There's nobody there that you're going to walk out the room and say, hey, could you come try to stick this person? You're not going to call a lab to come up and do it. You have to be able to do it. Same with a lot of the other skills that, in home health. Another instance I had this week was a wound vac, which there is such a thing. I know it's kind of crazy, but you attach a vacuum, basically, in the name, to a wound, and it kind of sucks, has low suction on there, and it pulls out the drainage and it stimulates the tissue growth, so that if people have these complicated wounds in different areas, it helps them to heal. And so if you're not, almost expert level on wound vacs, then you're going to get in some of these situations where, you know, you go into the home and there's nobody there to help you. You've got all the vac off, but you can't put the other one on because you don't know how to get the seal right. You have to seal it and all that. So I had that instance this week. I did not have any problem at all. I did not know this patient even had a wound vac, because that's another thing about being a traveler. You don't know these patients in home health. I don't know them. I walk into the house. I try to read the note before, but if sometimes the nurse does and sometimes they don't document everything. I don't have time to sit there and read the whole chart before every patient. I figure I'll figure it out, and I always do. So walk in, oh, here's my wound vac. Okay, well, let's change it. Where's your stuff? And it was no problem at all, and no issues. And so see, that's the thing about home health and any kind of travel nursing. You need to be at a level where you can do what's required of you with minimal assistance. So people fishing, looks like fun. Bumpity bump, everybody. Okay, so moving on from the type of nursing that you can do as a traveler, for now, we can come back to home health another day and I can talk about that. If you know, or any other subject you guys want me to talk about as far as nursing or biking or traveling, you know, you guys just put it in the comments, because now I figured out how to turn on the comments. I did not know how to do that, but now I did. So you can comment and ask me a question and I can address it. I'd be happy to. So what's going on now with my contract is I am getting towards the end of my contract. I'm about 3 weeks out from this contract being over. So I need to find another contract, another place to go. I'm going to take a week off, maybe 2 weeks off, go visit family, go check on my house. But I've got all the recruiters calling. So you just go on there and you apply. There's different apps, like I've said before, different apps you can use. Vivian's the one that I usually use. Shout out to Vivian for being so convenient. You can put all of your resume on there. The recruiters can pull it off. You can put your references on there. They'll check the references. They don't have to keep checking. I mean, it's a really good service, Vivian. So, and you have to know what to kind of look for. So in home health, some of the things I look for in my contract is pay, obviously, because there's a minimum and you'll have to figure out what your minimum is. But, you know, you have your expenses and your bills and your goals. Everybody wants to work for the highest amount. I do too. But if you're kind of on the newer side and you don't have a lot of experience, you're probably not going to get those higher paying ones, or you might, because sometimes some of the higher paying ones are in areas that people may not want to go to. Somebody offered me a high paying job in a very remote area in the country and stuff, and I was like, no, that's not enough money. I'm not going over there for 3 months, because what am I going to do with myself? But I mean, it's your goals. Maybe you're traveling with your husband, or maybe you're traveling with your boyfriend, or maybe you like to go jogging and so you don't care. You just, you know, maybe you like painting, or maybe you love the country in remote areas. So I mean, those jobs are for someone, but that's not for me. I'm looking for more interesting places, interesting bike rides, places I can ride my bike, historical sites, access to the kind of food, because I'm a foodie, but not in the way you think. Sorry, Jada, but my sister Jada would really, really, really love me to go to some restaurants, because she doesn't like to go out. She's, you know, it's very expensive and she doesn't like to do it. Just go out random, and all these places I go, and there's cool places to eat. She would like me to go in there and take pictures of the menu and taste things and tell her how it is and all that stuff. Well, I'm not that kind of foodie. I don't really care. I'm going to go in there and order vegetarian, if I go in there at all. You know, I'm the kind of foodie that shops at Whole Foods, Trader Joe's. You know, I'm looking in the Whole Food, you know, organic section. So if all they have in that town is IGA, then that's probably not going to be the best choice for me. I've done a contract or two in that kind of environment. It hadn't worked out too good because I was struggling. I mean, I was only eating what they had available at Walmart. And love Walmart. You know, they do have a lot of stuff at Walmart. But, you know, things are odd things that I need. And they're not even odd. Things like mayonnaise, organic mayonnaise. I ended up having to make my own mayonnaise, which isn't bad. It's good. But, I mean, here I'm making all this mayonnaise and then have to throw away most of it because how much mayonnaise, you know, and organic mustard, stuff like that. So that's important to me. I'm that kind of foodie, that kind of organic person. Okay, they're going to move to the left. I'm going to pass them on the right. Thank you. Thank you. We're just going to keep going because you know what? It's a nice day. I did not look. It's cool out here. It's not raining. I didn't look at the amount of mileage I had when I started. So I don't know. I'm thinking that this far is about 7 miles from my apartment. So, but see what I say? I go out and then I don't come back because once I start going, I'm like having too much fun. Why in the heck would I want to turn around? Anyway. So that's one of the things is I look for like access to food for me. You know, I eat kosher meat and I only eat kosher meat and I like fresh seafood. So I look for areas that are going to be accessible like that. Like I said, also to me, interesting places are historical sites, beaches, waterfront, mountains, because I'm wanting to ride my bike. That's what I'm doing. I'm riding my bike. So, you know, places that are interesting for my bike, for bike rides and, you know, exploring that way. Safe. If it's got a, you know, if it's a good place to, got a lot of trails like this, that's going to be on my list of things that would be interesting, and I would probably look at that if it meets my minimum requirement. Okay, so another minimum requirement is home health is 5 days a week. So I need guaranteed hours because your stipend is dependent on your hourly, how many hours you work. So they need, if they don't guarantee you hours, it may not be your fault that they don't have patients. The patients may be in the hospital, they might hire another nurse while you're there, all that stuff. And you might only be actually working 32 hours a week. Well, that's great, but I didn't go up there to work 32 hours a week. I'm doing a contract up there, and I want my money, number one, and number two, they won't, your stipend, some agencies don't do it this way, but a lot of them do. You get paid your stipend based on how many hours you work. They don't take into account that you have to pay your rent for the whole time you're there, or whether or not you work or not. I mean, it's not your fault. So some agencies, I mean, this is something to look for when it comes to agencies, when you're shopping for agencies. If you're already an RN and you're thinking about traveling and you're shopping for an agency, I mean, it is a good idea to find out if they have, if they're going to pay you your stipend if they call you off. Now, a lot of the best agencies will. If you call off, then they may not pay you your stipend. But if they call you off, they'll pay it to you. Because you'll go to some hospital and you'll get called off and you won't get paid your full stipend for the week, but you still have to pay your rent, which is expensive. So that's the other thing. I mean, whenever I'm going somewhere, I'm looking to see if there's housing and what kind of housing and how much the housing is. There have been places that I've thought about going and I didn't even apply because when I looked to check out the housing, because before I even apply, I'm going to check out the housing, I found that the housing was either really expensive, you know, or it was not available. I mean, there was one place in the desert, I want to say it's in Utah somewhere, that literally there was no housing. And I thought, how is anybody even going to go over there? There's no housing. So, anyhow, obviously the people contacted me and I said, listen, I don't have an RV. If I had an RV, I might go over there, see if I can check out, find out some kind of RV park or something, or somebody have some place you can rent. But I no longer have an RV for traveling. So, yeah. So, talking about housing again, that's another thing, is whether to rent something, a hotel. I mean, see, we can keep going and going on the traveling. We're already at 30 minutes here chatting about it. So I tell you what, these videos can get long whenever there's just so much information that I'm going to get up here to this little cove and I'm going to push stop and turn around, because now we're further away from home than we need to be probably. But look how pretty this is. Isn't this pretty, this little view? I haven't been this far down. Maybe I'll keep going. We'll keep going, but I'm going to stop it and do a part 2 on travel nursing details or something, because, yeah, this can go on and on.